But
Mhm.
if someone were sitting here and said, okay, my blood test came up, but I still have a inkling that I might be deficient, what would be your advice, or what would be the symptoms you'd say, hey, look out for these things because it might be true that you are magnesium deficient?
Right. I think that's the most important thing too, is the fact that, regardless of what any of test says, no test is perfect. And so if you're having symptoms of magnesium deficiency, and then all of a sudden you empirically start taking some and they go away, that's a pretty good indicator that you were deficient.
Yeah.
But yeah, some of the main symptoms of magnesium deficiency would be muscle cramps, muscle spasms, your muscles just locking up. So basically this tetany can happen. Twitching of like the eyelids, twitching of muscles too can happen. Sleep disturbances, photosensitivity, tinnitus, which is ringing in the ears, can be caused by magnesium deficiency. Even mitral prolapse has been shown to be due to magnesium deficiency, and giving magnesium in people with mitral prolapse has been shown to improve that. But vitamin B1 deficiency can contribute to that as well. Osteoporosis, heart conditions, high blood pressure, kidney issues, cognitive decline. I mean, there really isn't anything that magnesium doesn't touch or affect, because we now know that it affects over 800 enzymes as a cofactor for these enzymes to function. So 20 years ago, when I first started researching magnesium about 10 years ago, but 20 years ago, all the scientific literature said 300 enzymes magnesium was dependent
Yeah.
on. Then 10 years ago, it went up to 600. Now we have documentation of over 800 enzymes that it's a cofactor for. So that's kind of why so many symptoms can happen when you're deficient in magnesium.
Yeah, and I know people that are, eat very healthy, do work out, maybe even supplement magnesium. But some of the ways that you become deficient as well, one of the things you said is this chronic stress. We live in a very stressful environment. Everything around us is a stress, and that depletes. Can you go into how that works, almost the mechanism to how we're depleting ourselves just through the stress we live with?
Yeah, so the stress hormones, particularly noradrenaline, will actually kick out magnesium in the cell from that stressful type of response, and then you lose it in the urine. So that's actually the mechanistic piece of how it happens, is noradrenaline kicking magnesium out of the cell, and then we lose it through the urine. And so it's this vicious cycle of more noradrenaline release, more magnesium is pushed out of the cell, and then more is lost in the urine. And so many things are causing us to be deficient in magnesium: over consuming caffeine or coffee,
Mm.
having elevated blood glucose levels, elevated insulin will increase magnesium loss out the urine. The cell being insulin resistant, you can't even push magnesium into the cell well when it's insulin resistant, which 88% of Americans are metabolically unhealthy. So
Mhm.
that means basically 9 out of 10 people are struggling probably to get magnesium into the cell where they need to get it into. And then you have many different things, many medications, diuretics, proton pump inhibitors, antacids that can cause
Yeah.
magnesium deficiency, and many nutrient deficiencies. You don't get enough B6, you're not going to absorb magnesium well or get it into the cell. You don't get enough selenium, you don't get enough salt. A lot of people don't realize this. Basically, if you don't consume at least a teaspoon of salt a day and you're working out about an hour a day, you're going to go in a negative salt balance and also negative magnesium and calcium balance, because the body's going to pull sodium from the bone to try to maintain a normal sodium level in the blood, but it pulls magnesium and calcium from the bone at the same time, spikes magnesium in the blood, tricks the body into thinking you're overloaded, and then your body downregulates the absorption of magnesium and kicks it out. So actually, not getting enough salt leads to magnesium pulled from the bone, and it also causes more magnesium to be lost in the sweat to conserve sodium. So there's a whole plethora of reasons of why someone could be deficient in magnesium.
Yeah, it really is this. You got to kind of look at everything you're doing. Like you mentioned, those PPIs like Nexium, Prilosec, they're depleting you and you don't even know it, right? You think you're taking a medicine to improve where you are, whether it's GERD or antacid, and you're actually being depleted. And just to like really nail it home, I saw this like a researcher that you wrote eliminating a magnesium deficiency may produce a higher return on investment and a higher reduction of disease and pain in a shorter time than any miracle drug or high-tech development. Do you share in that sentiment?
Yeah, of course, because that's a root cause to a lot of
Yeah.
issues. So, nobody has a medication deficiency. I'm not saying
Yes.
medications can't have benefits. Of course they can. But when it comes to chronic health conditions, Many of them are either contributed by or literally caused by a deficiency in either one nutrient or multiple nutrients. And you simply fix the deficiency and you fix the disease, chronic diseases that I'm referring to.
Yeah, no, it really is this master mineral of sorts.